LIPAC stands for Limb Preservations in African Americans After Katrina. And it was designed as part of the recovery program after Katrina. We were asked to design a program that might help in the medical recovery of the city. So we selected this particular topic because we were very concerned that the Medicare population of New Orleans had lost their primary care physicians. We also did it because we know that Louisiana has a very high amputation rate amongst diabetics, one of the highest in the country. And we also knew statistically that African Americans had a far higher diabetic amputation rate than Caucasians did. But it was particularly bad in New Orleans. So therefore we designed this project to educate patients about diabetic foot care and to also work with docs and educate docs about what can be done to prevent amputations in the diabetic individual. It was an excellent response by the primary care practitioners in New Orleans. They understood the need for the program. They understood the value of educating the patients. We were able to increase the individuals obtaining foot exams by their physicians. We taught patients why the doctor does the foot exam, how the foot exam is done, where the monofilament, which is like a fishing line, is touched to the bottom of the foot until the monofilament bends, and then if the individual can feel the touch, that indicates that there's intact sensation. And the loss of that protective sensation is critical to the process of the individual patient winding up with a foot amputation. In addition, we emphasize to the patients the importance of knowing what their hemoglobin A1C is, which is an excellent measure of the control of diabetes and is very important in reducing the damage to the nerves that is so critical in individuals having foot ulcers and then having eventually an amputation. And very importantly, we taught the individuals how to better communicate with their physicians, explaining their symptoms and asking the right questions that allowed the physician to get to the right diagnosis, adjust the medications properly, and so on. So it very much improved the interaction between the patient and the physician.